Hello, and welcome to another session of Health Talk with Dr. Arie. You are listening to Dr. Arie. So we are at the final stages of our Health Talk series on cervical cancer. Today we are looking at cervical screening. Precancerous cells do not cause symptoms. Hence, screening allows us to be able to detect early changes that takes place at the cells of the cervix so that we can do something about it before they become cancerous. So screening does not diagnose cervical cancer, okay? Cervical screening does not diagnose cervical cancer. It's only allowing us to detect the early changes that takes place at the cervix before they become cancer in the first place. Presently in the UK, cervical screening or the smear test is offered to people between the ages of 25 to 64. This is because cervical cancer is very rare in people under the age of 25. And also as you get older, the risk of cervical cancer is less. Cervical screening is routinely offered to people every 3 years between the ages of 25 to 49. Then from age 50 to 64 is every 5 years. So if you are at that age gap, you may have noticed that difference. Often you may receive a letter which invites you to either go to a screening center or to go and see your local GP where you would have your screening done. It is quite a simple and easy procedure to do. It may be carried out by a doctor, by a nurse, or a trained healthcare professional who is outside of any of these roles. It is really important to keep your appointment when you receive your letter to go for cervical screening. In other parts of the world, this national screening program may vary, from country to country. So, if you're listening to me, you don't live in the UK, it might not apply to you what I've said in the same way. So it's always important to find out what is going on in your own area regarding health screening for cervical cancer, so that you can make sure that you keep your appointments and then so that you are you get the benefits of having your cervical screening, so that you don't miss out. Okay. Now, usually after you've had your smear test, which most people call it, there could be possible outcomes. Okay, so when a sample from the cervix is taken, it's then taken to the lab to be processed, and out of that there could be possible outcomes that you might receive. So the results often would come maybe 2 to 3 weeks later. Your local practice will get a copy, and also you would get a copy to your home address. And the possible outcomes that you could have, first of all, it might say that your smear test was normal. It might say something like, we did not detect HPV. So HPV is the human papillomavirus. If you remember from one of our episodes, we talked about the main cause for cervical cancer being a virus called human papilloma, HPV. So your test results might come back and say HPV was not detected and there was no abnormal cells, and therefore we don't need to do any further testing. We put you back into the routine recall. So for that individual, you may go back to the routine call, which will be every 3 years or every 5 years, depending on which age group you are at the time when you did your smear test. Okay. The other possible outcome that you might have after your smear test is to receive something that it might tell you, we did detect HPV, which is the human papillomavirus, but there were no abnormal cells. Now, because HPV is actually the main cause for cervical cancer, if it's detected when they do your smear test, it is important that we follow you up a bit more closely to make sure, obviously, that there's no further changes that take place, because this virus is the one that causes the changes at the cervix that may become cancerous. So for individuals, we may have a positive HPV but have normal or no abnormal cells at the cervix. You may still be recalled. You will be recalled usually 12 months later, so a year later. This is to allow us to be able to look again at the cervix to see if your body has naturally cleared the virus. Okay. Now, if you remembered in our series when we talked about HPV, we said it's any virus, just like you had a cold virus, yeah, it would normally clear from the body. Most people will clear it by natural immunity. Okay, so that's why they give you the year to allow to see if the body can actually do this naturally. If it still persisted, often you will be called to do a more detailed test in the form of colposcopy, where they actually have a closer look at the cervix to see if there's any changes since they last saw you, or whether we need to do any treatment. And then based on that second review, then you'll be followed up from there on whether you need to go back to recall or whether you should still be seen a bit more closely. Then the third possible outcome that one could have after they've done the smear test is to have a positive HPV as well as abnormal cells at the cervix. Okay, so in this group of people who have the HPV and then also have abnormal cells, usually they look at the degree of abnormal cells. So it could be mild changes or moderate changes or severe changes. But no matter how, no matter the degree of severity, whether it's mild or moderate or severe, this group of people would always be offered some form of treatment. So you'll be invited for colposcopy, which essentially they're going to use a big magnifying glass to have a closer look at the cervix and to see these changes, how bad it is, and then you'll be offered treatment. So as you can see, there's different outcomes that can happen when someone has a smear test. Okay. Now, if there's abnormal changes and you have the treatment, often this is the stage that you really want to catch it at. Okay, so the people that have HPV and also have abnormal cells, this is the stage that you really want to be able to pick before things get too late. All right. Sometimes when people have a smear test, they may be invited to come back for a repeat test. And this can be a period of anxiety for some people, because you'll be wondering what happened, what went wrong. Most of the time it's not because anything really serious. It could be because at the initial stage when you had the smear test, enough sample was not taken, which sometimes is difficult for the person performing it to know at the time whether enough cells has been taken, because we're not seeing it at the cellular level. We're just doing a sweep at the cervix and sending off to the lab where we can have a closer look. Okay, so often by the time it gets to the lab, they realize actually there's not enough cells to give them enough information about whether there is a virus there or whether there is abnormal changes at the cervix, and often you'll be called back to have a repeat test. So usually that's the main reason why. Okay, because this is serious. Cervical cancer is serious, and we want to be able to make sure that we are giving you the right information. We're not giving you any false assurance with inadequate sample, and that's why you would usually be called back to have a repeat test. So if this happens and you're worried, do feel free to talk to your nurse, to talk to your doctor, or any practitioner that you're seeing at that time to just explain a bit more for you. Okay, so I hope this information has been useful. Please, I would encourage all women who definitely are in the age group to have the smear test, the cervical screening, not to miss it. In the UK, often we do send loads of letters to people, reminder letters to have your screening done. Please do not abandon it. Do not think, oh, why are they bothering me? Cancer does kill, okay? And cervical cancer is something that can be prevented if it's seen early. So don't take the risk. Don't ignore. No matter how busy you are, your health is always important than that. Okay. So make sure that you do your screening test. And also, if you live in other parts of the world, I know often systems are not in place, and therefore sometimes you're not sure, but you have the information now. So please do make it a point. Just find out in your locality what is available for you. Sometimes you might have to travel a little bit further to have it done. If that's the case, then do make an effort to have it done, because it is important. If it can be treated on time or prevented, then why not take that chance and make sure you get the help that you need. So thank you for listening again. You've been listening to Dr. Ario, and take care of yourself. Bye-bye.